Welcome to Pharmacy to Dose, the Critical Care Podcast, where we're discussing critical care and its pharmacotherapy in a fun and entertaining manner. And I'm your host, Nick Peters. Wherever you are and however you are listening, thank you. Now, a quick word from our sponsor, QXMD, before we get into part 3 of our episode today. QXMD builds mobile solutions that drive evidence-based care in clinical practice. So check out Read for easy access to research personalized for you, Calculate for over 500 easy-to-use decision support tools, and Learn to earn CME online in minutes per day. Try them today at qxmd.com/apps. Again, that is qxmd.com/apps. So welcome back to our special 3-part episode on the critical care medication March Madness bracket. You know, our incredible bracketologists have spent the last 2 episodes giving in-depth, expert, insider analysis. And if you haven't listened yet, go back and do just that. You can, should, and need to listen to our experts. You know, they are Brian Gilbert, Matt Rubertus, Josiah Smith, and Melanie Smith, breaking down all 4 regions in the tournament, giving you all of their insider knowledge that you all are looking for. Now, we've made it through all 4 regions, and our final 4 is set. So we have the 2 1 seeds, norepinephrine and piperacillin-tazobactam, and then some 4 seeds, Kcentra, or the 4-factor PCC, and ketamine. So a reminder that if you go to pharmacytodose.com, our website, there's a downloadable bracket that you can print out or fill out electronically. And on Twitter, we are still voting on matchups for the official listeners bracket. So go to @pharmacytodose, TO to dose, vote, and then give us a follow if you haven't already. The Sweet 16 is set. The current matchups are voting to see who gets into the Elite 8. But we're going to vote until the national championship game, until a winner is crowned. So go ahead, log on, get going. Every vote counts. And we're certainly not done yet because all 4 bracketologists are coming back. We're talking the final 4, and ultimately who is cutting down the nets and declaring themselves the best medication in critical care. We are driving to Atlanta, and we are going to figure out just that. So let's get going. Matt, welcome back. And a quick reminder to everybody that the cardiac region had the favorite, the blue blood, norepinephrine advancing. And so the first semifinal here, 1v1. This is norepinephrine versus pip/tazo. This kind of feels like the old, thinking about the 90s, like that, the Duke, Kentucky, where, you know, Leitner hits the turnaround. It feels like that would be one of these games in real life if these two actually met, of just, wow, how do you even pick?
Yeah, I agree. I mean, this is close. And I'm going to go with the homer pick of norepinephrine beating pip/tazo, specifically because when you think about like a septic shock patient, yes, you need the antibiotics to treat, and pip/tazo being very broad, is able to cover a lot of different pathogens. But in septic shock, the pip/tazo is going to take a little bit of time to work, and the norepinephrine is actually going to keep your patient alive while the antibiotics are able to work. So I actually have norepinephrine just being sort of the acutely keeping your patient alive drug advancing. But you're right, it's very close.
Now, the second semifinal, it's 2 teams that are just peaking at the right time. They're both the 4 seeds, and it's Kcentra versus ketamine. And I think this is kind of a perfect matchup for what we're kind of talking about within critical care now, because I think if you go to any conferences, even if it's not critical care focused, you're definitely going to hear about, you know, PCCs and ketamine. So kind of perfect that they're kind of facing off against each other.
Yeah, and they're also so different. So the other matchups, you know, you can think about a septic shock patient when you're using both norepi and pip/tazo. Not a lot of scenarios where you're doing ketamine and Kcentra together. So it's kind of an interesting matchup as well. But for this one, I had to pick with my heart and go with ketamine. It's one of my favorite drugs to use. It's a great sedation med, and it's something that we use quite a bit in my ICU. And I like it because, one, it doesn't depress respiratory drive, so it's another one of those where you can give it to patients while they're awake for procedures without worrying about their breathing. And then also just it's great for continuous sedation when you have patients who are young and agitated and kind of going through, kind of our normal sedating agents and analgesic agents. So to add it on top, giving a little bit of analgesia and sedation, I think ketamine just beats out Kcentra.
So this is kind of a matchup, it sounds like, of two of your favorites in the national title game of norepinephrine versus ketamine. So who's walking up the ladder at the end of this? Who's the ultimate champion?
I was really rooting for the underdog here for ketamine to get their one shining moment, but ultimately I think norepinephrine comes out on top. I have to pick with my head rather than my heart with my love for ketamine. But, not to bring up too many bad feelings, this is like Gordon Hayward throwing up the half-court shot against Duke in the final, just not quite getting it done. So norepinephrine comes out on top.
They just needed to move it just like a centimeter and a half to the left, and they would have somehow made it. Yeah, that doesn't still bother me or anything. No, definitely not.
I thought maybe it'd be a good descriptor for this one.
I like that. Now, so the ultimate champion is norepinephrine. Now, how does that compare to what you would consider as your actual favorite, like, critical care drug?
I guess I use norepinephrine so often, and it's so prevalent in the ICU in any setting that it's just, I have kind of neutral feelings about norepinephrine as a drug. It's got great, activity. It's great for what we use it for. But really, I think ketamine is just such a more fun drug, and I kind of like using it more. I get to do more teaching with the medical team about ketamine and students because it's not something that they see very often. And so when we have, medical residents come through and we're using continuous ketamine for sedation, I get to do a little bit of extra teaching on that. It's kind of fun. So I think really I was pulling for ketamine, but norepinephrine, like I said before, before I even saw the bracket or the list of medications, I thought this was their tournament to lose.
So that really was a matchup of your head versus your heart is what I took away from that.
Absolutely.
Matt, thanks for joining us. Our mutual love of basketball. I thought this was an absolute perfect fit, and I really appreciate you kind of taking the time to join us. Now, what's your Twitter? Now, what's your Twitter handle for the listeners out there?
Well, it's actually at Matt Rubertus, just my name. But full disclosure, I don't know if I've tweeted anything in the past 3 years.
I think the last thing you tweeted was when somebody tweeted out that if the Cavs beat the Warriors, they were going to give everyone a free jersey. Do you remember that? There's it was like a 2 million retweets because everyone thought they were going to get a free jersey.
Yeah, I vaguely recall that. I'm sure it was during one of the 4 finals in a row, and not 2016 because I didn't get a free jersey out of it.
Yeah, that is true. Well, thanks again, Matt, and I hope you make it through the winter, because if you're able to make it through that, summertime in the summertime Shy is the absolute best. So you're in a fun spot up there.
Yeah, I'm looking forward to experiencing the summer up here, because when I got up here, it was already starting to get kind of chilly. It's
coming. Thanks again, man.
All right, thanks.
Welcome back, Josiah. Now a quick reminder for everybody. So from the ID region, the favorite Piptazo, the 1 seed, advanced. So we have the first semifinal, kind of pits the 1 seeds, the powerhouses against each other. We have Piptazo versus Norepi. Ooh, I'm glad I'm not picking it. Who do you have going on, my friend?
All right, so I thought this was it's a very tough matchup. It's hard to beat a drug that is literally keeping you alive at the end of life, like norepinephrine may be doing. However, I'm going to say, if you're experiencing septic shock with an infectious source, good luck not using Zosyn to actually beat it. We're going to have to actually get to the root cause of what is causing this issue. And so I'm going to have to say that I still think Zosyn can beat norepinephrine, specifically because norepinephrine, is going to be highly dependent on if Zosyn is actually going to be covering the bug that may be causing this sepsis and shock-like picture. So in a sense, you could say one would not be effective without the other, depending on what specific disease state we are looking at. But obviously, I'm trying to sell Zosyn to win, so we're leaning on that Zosyn side. The other thing I like about Zosyn, we don't have to think about any special line placement or anything. You don't have to do any extracurriculars of worrying about getting in central line, depending on what your concentration is, or really worrying about those extravasation type of things that we may have to worry about with norepinephrine. I like that Zosyn, kind of tying back to a basketball theme. We have different offensive schemes that we can use. Do we want to use extended infusion? Do we want to use conventional dosing? Do we want to use continuous dosing? I think it's just got a lot more diversity than when it really comes to norepinephrine. The only weakness I see with Zosyn is, if you've got a penicillin allergy, that could be an issue if there's some drug resistance. But I think overall, Zosyn usually comes out stronger on the other end, and people still feel very comfortable using it. And so I'm going to say, surprisingly here, that Zosyn can still beat norepinephrine in this matchup.
I think all of us who have read the Kumar study in critical care medicine showing the time to effective antibiotics and the rate of mortality would completely agree with you, because I think I can't remember if it was 36 or 48 hours, but the mortality is basically at 100%. So Norepinephrine can be the Band-Aid, but if you don't treat the source, there's nothing you can do. So I think people would be hard pressed to disagree with you there.
That is very well put. I couldn't agree with you more.
Now we have the second semifinal. We have the 4 seeds, kind of the gritty, scrappy teams coming through. We have Kcentra battling ketamine. So who advances to the national championship game here?
Yeah, so I'm looking forward to the matchup. I'm going to say it's going to be ketamine here over Kcentra for me. A lot of my patient population that I deal with working in a medical ICU, we do see ketamine used quite a bit, and it's kind of made its resurgence over the last couple of years that I've been practicing. We go from not talking about it very much during residency, besides just specifically learning about it, to it coming up almost every single week on if we should use it or not. And who's comfortable using it or not is a lot of the big issues that comes with it. I like ketamine simply for its diversity. It's an old, experienced drug that kind of got a bad rep for a little while. It's very diverse in forms that we could use it for status asthmaticus, status epilepticus. It's a great pain drug. There's a lot of good theories out there that sometimes it can help kind of reset that pain threshold for a lot of people, using kind of multimodal pain management. We've got good evidence. A lot of people didn't like to use ketamine because of its side effect profile, of its hallucinations, dissociative effects, as well as some of the others. But we've got dosing out there now that shows, using doses of 0.3 mg per kg, we may not have that dissociative effect anymore and have great pain control. So I really like that we can use ketamine for that. It's great for procedural sedation. We'll use it a lot of times on trauma patients that are coming in to help calm them down a little bit and also help reduce their pain. And so I think that's what would take it over the top with Kcentra. With Kcentra, there's still a lot of questions that people have about its use, and what's the proper dosing for NOACs and DOACs? What's the proper dosing for warfarin? Should we even use it for that? And so I think with all that uncertainty and analysts looking at it and having all these questions about it, I'm going to go with ketamine here over Kcentra.
So we made it. We got the national championship game here. So we have Piptazo on one side and ketamine on the other. So who's going up and cutting the nets?
I am going to say I'm going to stick with my champion, and I'm going to say Zosyn here over ketamine. I think you made an excellent point a little bit ago about Zosyn has and antibiotics have proven mortality effects. I don't have any knowledge to mind that ketamine has any mortality effects, specifically, depending on, I guess, what disease state you use it on. But Zosyn is going to beat ketamine in this situation. So Zosyn is the champion overall.
And Duke gets Gets another banner. Gets another banner
Yes,
here.
it gets another banner. It's very, that always hurts my heart to hear that with Duke. So maybe we can say Gonzaga. We'll say Gonzaga can get their first banner or something like that. Make it a little bit better. But yes, I think Zosin is kind of our clear-cut champion here in terms of meds that we're using in the ICU.
Now, I'm guessing as an antibiotic steward that Zosin is not your favorite kind of critical care medication. What would you say is your favorite, like irrespective of bracket region, et cetera?
Yeah. And so while I do with infectious disease quite a bit every single day, I feel like my hospital director and clinical manager would be very upset by me saying that I would say Precedex dexmedetomidine is my favorite drug. And the reason I say they would probably be upset is more specifically from a cost standpoint. Is always what comes up. I've always liked Precedex. I love it. I like that it doesn't have any respiratory depression that comes along with it. I like that it can be multimodal in terms that it may be helping with pain, it may be helping with agitation, it may be helping with anxiety. We can use it for people with alcohol withdrawal. We can use it for people, weaning between vents and trying to get them off the vents. And overall, I just think it's a great drug for what it is. The only bad rap it really gets is because of its cost. But if you can find some equally efficacious things that would be equivalent to using that, I would be more than welcome to hear it. But I am definitely a fan of Precedex.
Well, we made it through. Josiah, lucky to call you such a good friend and colleague, and glad you could come on and kind of combine some of our favorite things, which is pharmacy, critical care, and basketball. So what's your Twitter handle for the listeners out there?
Yeah, so my Twitter handle is @Josiah Smith. I was one of the lucky ones that didn't have to put any numbers after their name when I first got this Twitter from starting it early back in the day. So you can find me on there. I'm more of an observer than an actual tweeter. I love following infectious disease stuff on Twitter and critical care medicine things on Twitter. So while you may not actively see me tweeting, I am definitely reading a lot of the stuff that everybody's putting out there.
You're lurking.
I am a lurker.
Well, thanks again, Josiah. And then, of course, as always, let's go Dogs.
Go Dogs. Thanks for having me on, Nick.
All right. So we are back with Brian here talking about, we just reminder that he had the 4-seed Kcentra advancing from the Potpourri region. And we have him back here to talk about the Final Four and who we think is going to be the ultimate champion of critical care medication. So, Brian, welcome back.
Thank you for having me back, man. Appreciate it.
Now, our first semifinal is between arguably the hottest medications in critical care. I mean, you go to a conference and you just cannot hear enough of these two meds. It's the 4 seeds Kcentra taking on ketamine.
I agree. Everyone has an opinion on it, one way or another, whether it's good or bad in this situation. So, even SCCM this past year had a pretty controversial opportunity when it came to Kcentra versus other things. We had a pretty hot take from one of the sessions, and a pharmacist sticking up for another pharmacist. Well, we won't go into that, but had to do with Kcentra in that setting.
But if you want to hear more, the SCCM Congress recap with the conference correspondent Anthony Hawkins and I dive a little bit into that. Yeah, we had pharmacists always have the back of other pharmacists here, especially when people are making comments that have some disclosure forms they need to fill out.
Oh yeah, I mean it was having been front row for that, it was an interesting dynamic, and to see one of our leaders, the godmother herself, Gretchen Brophy, get up there and stick up for us pharmacists was amazing to see.
So now back to the bracket. Kcentra versus ketamine. Who do you have winning here?
And man, I put myself into palpitations with this one. It's either that or the Red Bull and Bacchus from trying to quarantine them, as I'm calling them, quarantinis. But the Kcentra is a med that, while overall does have a niche when it comes to coagulopathy. It can be used in a handful of patients and a widespread of critical care patients. You could probably say that about ketamine as well, but in terms of dosing strategies and different indications, and I'm a ketamine supporter for sure. Like, I really do enjoy it. And so this would be another one that would be just fantastic to watch. This would be a close back and forth battle. I believe that, again, you either really love ketamine or you really hate it. And the same thing with Kcentra, you either really love it or you would rather use something else in certain situations. But when you look at it overall, and then I've got to give it to Kcentra. I can't not give it in this situation, especially when I think about the patient populations that I see, the opportunity for utilization, and then overall cost effectiveness. If I'm giving it to a patient and their bleed doesn't expand and I can get them out of the ICU faster, or I reverse their coagulopathy, I reduce blood product utilization and adverse events, and that's my spiel, that's my salesmanship. This is the old car salesman in me coming out. So team Kcentra all the way.
Okay, because I was gonna say you ended with Team Kcentra all the way, because it sounded almost like when you were describing the matchup that if you were to see this like game in person, you'd wear the split jersey and it would be like Ketantra or Kcenamine. I don't know how I would say, but so it sounds like you're not the split jersey guy then, just for the record.
I've got the house divided mailbox in the mail right now, ready to come with ketamine and Kcentra split. I mean, I love them both very dearly, but at the end of the day, I think that overall, if I had to have one thing in my back pocket, it's got to be the Kcentra. I mean, I can use for sedation and all that. I can use other aspects. I can use opiates, or I can use other things. And so, and there's controversy a little bit on the mixed data population for ketamine. So I don't think anyone's arguing for Kcentra or against Kcentra when it comes to bleeding coagulopathy. So gotta go with it.
Now, as hard go ahead.
I would write ketamine an apology letter afterwards, but
if this was like a hockey game, the handshake line would be tremendous, is what you're saying.
Well, we're not handshaking anymore. It's 2020, so we're social distancing. So
the elbow taps would be absolutely incredible.
Exactly.
And if that was a tough one for you to pick, I think this other semifinal might even be more challenging. We got the Blue Bloods, the 1 seeds, norepinephrine taking on Piptazo.
Yeah, man. Again, tried and true, some really good utilization for this. I got to go with norepi in this situation though, just due to widespread utilization and some of the emerging data on Piptazo and vancomycin combination, since we're always using the vancomycin combo and some of the AKI data. But yeah, no, this is a tough matchup as well. But if I had to have one thing in my back pocket for this matchup, I'd rather have a little norepi because I've got an alternative in cefepime usually for my Piptazo in that situation. So I got to go with norepi versus Kcentra.
All right, that's the final game. We got the 1 seed norepi taking on the 4 seed Kcentra. Okay, who's cutting down the nets?
Again, you talk about the matchups and what can I get? Can I get away with something else with Kcentra, or can I get away with something else with norepi? I can't really get away with anything else than Kcentra. I mean, I potentially could use fresh frozen plasma in that situation, but then I'm looking at volume overload. I'm looking at all the adverse effects, taco, trolley in those situations. So I can't get away. Kcentra is going to be my go-to. Norepi, I mean, I potentially can use other agents that potentially could convey the same efficacy or benefit that I'm looking for. So Kcentra is cutting down the net, and I don't want to hear anything about it.
Oh, we are the champions by Queen playing slowly in the background here. I like that team. Well, when you're able to see your team from beginning to end and cut those nets down. I can't imagine that feeling. So that's got to be why you're so enthusiastic. That love of Kcentra just coming out in full force right here.
I guess and suffice to say, I should just go ahead and say it. This isn't sponsored by CSL or anything. I don't have any. I have no conflicts before I get some pharmacist that comes up there and puts me in my place. I have no conflicts.
Yeah, this is the only sponsor we have here is QXMD. So that is, we have no industry sponsors of this pod.
And on this side of the call, there is sponsorship by bourbon, because I am drinking a little coffee and bourbon together to get through this quarantine. So, and to help me decide on some of these matchups in terms of going with my heart versus going with my head.
Well, and I feel like a quarantine kind of turns your house into an airport where like time, it's like a continuum. So it's like, you know, you
There's
go to an
nothing wrong with a
airport.
9 a.m. beer. There's nothing wrong with a 9 a.m. beer. I don't want to hear anybody say that anymore either.
Now, how does your bracket winner Kcentra kind of compare to what would you say is your actual favorite medicine in critical care?
You know, it depends on the day and it depends on the patient for sure, 100%. And I go back and forth on what's my favorite. But when I look at like tried and true things that I consistently go back to and have positive feelings and positive experiences with, it is Kcentra overall. And I think that's why I feel so strongly about it winning overall, is that if used appropriately, it can benefit a wide patient population. And specifically, we haven't quite found the appropriate dose. I still think that we're going to need to explore it even further. And so I understand that it may hold a little bit of an initial price tag and price burden on some pharmacies. But with some of these lower dose regimens, I think that you can get by, and it potentially can spare you from other adverse events later. So yeah, I'm going with Kcentra as my tried and true.
And it lines up with your favorite. That worked out. That worked out perfectly. I didn't actually know that before I asked that question, that was your favorite. Well, Brian, thanks for taking the time, joining us today. Hopefully everyone was able to, view this as a good kind of respite from all of the news and things. Now, what's your Twitter handle for the listeners so they can let you know how much they agree with all your picks?
or have something to say about it.
Hey, you said that, not me.
It's at Gilbert PharmD. I don't have anything very clever there, but I would love to hear it. And thank you for having us, and thank you for holding this, especially in this trying time. And it's just one thing that I've been looking forward to, having come off service this past week and trying to take care of folks, and the seriousness of it and the amount of things that it's affecting in terms of our daily lives, our professional lives. And I just can't thank you enough for doing this. This is something that I think that the rest of the pharmacy world will appreciate and has gotten behind. And so overall, just thank you for doing the podcast as well. It just shines a great light on critical care pharmacists and all the benefit that we can provide. And so thank you for your service on that too, my friend.
Yeah, well, it's when you're in such a great profession and have all these great networks of people, it's very easy to do something like this just because of the people you get to call peers and colleagues, how great they are. So it's definitely the thanks go to all previous guests, all friends of the pod, everybody. But thanks again, Brian. You're gonna make it through it. Have a quarantini for me, please, and we'll talk soon. Thanks again.
Thank you.
So thanks for joining us again, Melanie. Glad you're back. And a quick reminder for all the listeners that the number 4 ranked ketamine advanced out of the PAD region. So let's kind of start with the first semifinal of the Final Four, a matchup of the 4 seeds just peaking at the right time. Kcentra versus ketamine. This feels like, in no pun intended, an absolute bloodbath of a matchup here, and just a kind of tooth and nail battle. What did you think?
bloodbath is a most appropriate word. Man, this is a tough one for me. So all of those listeners that heard my bracket know how pro-ketamine I am all the way. But Kcentra is definitely right up there on my list of best ICU drugs. I think Kcentra has really changed the game and how we are taking care of an aging population who more and more people are on anticoagulant therapy. So I think it's just a great drug that I love to use and can really change patient outcomes. But if you want to take it back and talk about kind of your general ICU patient, then I think you really have to go with ketamine here. I think Kcentra is just too niche to go all the way in this tournament. So really to kind of compare it to basketball, it's the type of drug that can shoot the three all day, but it can't protect the basket on the other end of the court. So it may score a lot of points, but a well-rounded drug like ketamine is really going to find a way to score more points by the final buzzer. So for me, ketamine wins this one.
Or they're the team that went, they shot threes throughout the whole tournament and then they went cold for 8 minutes. And ketamine just because kind of slow and steady won the race a little bit. They were able to get points in a lot of other ways.
Definitely one of those for sure.
So the next semifinal, just the heavy hitters in critical care, the 1 seeds, norepinephrine versus pipiracil and tazobactam, Zosyn.
Oh man, this is another tough one for me. So you have norepinephrine, probably your go-to vasopressor of choice, and then Zosyn, your big workhorse anti-pseudomonal. So if you're thinking about a septic patient, all the norepinephrine in the world isn't going to save you if you don't have the right antibiotic on board. Mm-hmm. So for me, if I was talking about a septic patient, I would have picked Zosyn all the way. But on the other hand, there are definitely a lot of other shock states out there that aren't sepsis, and norepinephrine can help you with almost every one of those. So I'm going to say norepinephrine in a last-minute overtime victory here.
All right, so it's ketamine versus norepinephrine national championship game, and the winner is?
Definitely going to be norepinephrine. I'm sad to say, as the bracketologist from the PAD region, similar to Zosyn and your Zosyn-norepi matchup, I'm trying to think about the most well-rounded drug here. And, despite ketamine being a PAD region favorite, I'm going to go with norepi. Just because, you can have all the ketamine in the world and be able to treat all their agitation. But if you have cardiovascular collapse, there's no PAD agent that's going to save the day. So for that reason, I'm going to go ahead and say norepi is the winner this year. It was definitely a hard-fought victory over a great team in ketamine.
Yeah, cutting down the nets. I think that was one of those where, all those matchups they're just a couple points, a couple possessions, because those are all in the tool chest. You're on a desert island, you'd like all of those to be with you.
For sure.
Now, how does your winner norepinephrine compare to what you would say is your actual favorite medicine in critical care?
Now, don't tell Brian Gilbert that I picked Kcentra, but I would definitely say that Kcentra is probably one of my all-time favorites. I was really excited to see that it made the Final Four, and honestly, that doesn't surprise me with that bracketologist. But there are definitely a lot of reasons why I like this. For the patient population that I take care of, I take care of a lot of trauma patients, a lot of patients with coagulopathies, so it's something that I use very frequently. And I also really like it because it's a newer drug, so it's being used for a lot of off-label things, which means there's a lot of room for research. So for us pharmacists that love research, this is definitely a hot drug that we are super interested in using and investigating.
Spot on. So, you literally, when you said, when you're going through this analysis, you truly went with your head with a lot of these, because your heart is Kcentra is there. So that's true expert analysis from our official bracketologist here. Yeah,
it was definitely hard for me to, pick the ketamine over the Kcentra. Even though I love them both, I do think that ketamine's the more well-rounded drug there.
Melanie, I hope you had as much fun as I did. And I really appreciate the analysis and insight and incredible nicknames. The Big Nasty is definitely not going away anytime soon.
Yeah, thank you so much for having me. This was actually one of the more fun brackets I've ever filled out, and definitely a great way to keep my mind off of all that's going on with the Big Nasty.
Yes. Now, what is your Twitter handle for the listeners in case anyone wants to get in touch with you?
Yeah, so my Twitter handle is Tribidibity, so I'll spell that for you because it's kind of confusing. It's TRIBIDIBIDY.
Now, is there some backstory?
No one told me. No one told me in college when I created a Twitter handle just to follow sports teams and Real Housewives that I was going to be on a podcast one day trying to explain, what that meant. But that name actually came from a kid at church, and that was just his nickname for me, and he thought it was funny. So, when I was deciding on names in college for my Twitter handle, that's what it became.
There we go. Well, thanks again, Melanie. And when I eventually visit Charleston, you'll have to help my wife and I eat our way through the city. Is that a deal?
Absolutely. I know all the good spots.
Okay, perfect. Thanks again.
Yeah, thank you again so much for having me.
Well, you heard it straight from the expert's mouth. The winner of the critical care medication March Madness bracket is norepinephrine. Certainly a hard-fought battle, but tough to argue against the ultimate winner. Now, reminder, this is the expert bracket, like the expert picks. If you think about going to looking on ESPN or CBS during March Madness time, it's the expert picks. So the listeners bracket, right? You all putting the vote in and who do you think is the best, is still accepting votes on our Twitter page at Pharmacy2Dose. So hop on, follow us, and then participate in all of this. We want everyone to get a voice. We want to keep those voting numbers continue to keep going up. Now there's a lot here in this 3-part series searching for the best medication in critical care, and hopefully at some point this can function as a distraction for anyone or everyone, for all of those in the hospitals and on the front lines of this pandemic, right? That hasn't even peaked yet. All of the feelings have to probably feel never ending. And I know every friend of the pod is wishing the best for everyone, myself included, wholeheartedly. I think we're all a pharmacy family here, and in times like this, that's what always shines through. I think that's the biggest thing you see is the network of pharmacists sharing information, being colleagues and peers and friends with one another in these trying times, and it just shows the connectiveness and the togetherness that everyone shows in these crises. I want to give another last shout out to the great guests and friends of the pod, the expert bracketologists, over this 3-part series. We had 4 of them, as everyone hopefully knows, and they were Matt Rubertus, Josiah Smith, Brian Gilbert, and Melanie Smith. So a huge thank you. Obviously, they did the analysis and gave their insights and really helped to make this and execute this to be as fun as I thought it could be. So don't forget that there's also a printable bracket available to be downloaded on our website, and it's pharmacy2dose.com. So there's going to be a few more things coming. We have a couple episodes in the pipeline and things. I know there's a lot of kind of recent content here, but especially with the critical care medication March Madness bracket, hopefully that's able to be a distraction, something a little fun and mindless that you can listen to kind of get away from some of the harsh realities now. So as always, please, I love everyone to reach out. So via social media, Twitter, Instagram, at Pharmacy2Dose, TO2Dose, or via email, pharmacy2dose@gmail.com. And until next time, I'm Nick Peters, and this is Pharmacy2Dose, the Critical Care Podcast.